भक्ताय भोजय प्रदाय धीमहि गुणीतेताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
Thank you all. That was a wonderful song by Rajeshi. Thank you. I would now request Dean Sir to unleash the banner and officially declare the event to be open. Thank you. Now I would like to invite Dean Sir to address the gathering. Sir, please.
Very good afternoon to you all, and greetings to you all from Manipal Tata Medical College, Jamshedpur. I'm indeed very happy to be part of this Biofest 2024. At the outset, let me congratulate the Department of Biochemistry for organizing this event for the third time in a row. You all deserve a big round of applause for that. What I'm saying is, Kavita and Dr. Sunita earlier, who was heading the department before Kavita, is institutes which are 10 years, 20 years old, 50 years old are reluctant to take up this initiative of organizing student activities. The department of this college started in the very second year of the inception of the college. Is a pride for all of us. Thank you, Department of Biochemistry, for that. And let the activity continue. She was telling me that first time it was in-house, second time it was e-zone, this time is within the state. I was not happy with that because I want this to become a national event. So next time it will be a national event and not an event confined to the state. Okay? So that's the assurance I want from all. And the juniors here who will become second years next year will be helping you in organizing a bigger event. Let's do it bigger and bigger because among the three first year subjects, biochemistry, it's a nightmare for some of them, but it's a very wonderful subject for people who understand what is chemistry and what is biochemistry. If you look at the first year subjects, anatomy is a big gross structure. Physiology talks about how it functions. And biochemistry tells you to the micro level. So it's a peak of the pyramid of the base of the first year subjects, biochemistry. If you understand biochemistry, you can be able to teach teach and also learn and treat as you progress over the years in your career. All the problems of all of us in terms of ill health is at a molecular level. So if you understand the pathology or pathophysiology at the biochemistry level, it's easy to take care of the community. So please remember, biochemistry should not be a nightmare. And I'm very glad to know that the Department of Biochemistry in my college is making subject very simpler and easier. And the fact that so many students have come to participate in the quiz speaks volumes of the interest of the students subject to biochemistry. Please remember, you should learn and read not to pass the exam, but to understand the subject. All I want to tell you, dear students, is when you pass out of the portals of your college, wherever you study from, learn so much of medicine so that you have confidence to treat your family members or your teachers. If your family falls sick, you should not send to some other doctor because you do not have adequate knowledge or skills. So please remember, your parents have worked hard to bring you to this level. It's up to you people to utilize this opportunity of becoming a doctor who can make a difference to the community as a healthcare provider. This is an important phase of our life of 1.5 years, or 5.5 years internship in today. Please give your 100% commitment. There's a lot of life left for us beyond these 4.5 to enjoy, to make life differently. At the same time, I'm not saying don't do anything. Involve in sports, involve in cultural activities, burn your calories, divert your mind when you're stressed into sports and these sort of extracurricular activities. Though it is a subject activity, it makes you think differently, feel differently, and have fun differently, meet people, and share your learning activities. I wish the participants the best of luck and let the best team win. Every participating team is a winner in my view because there's nothing like a winner or loser. Participation is more important than winning a prize. The fact that you have no fear to participate indicates volumes of your courage and conviction to learn and share your values in terms of the subject of biochemistry. I wish you all the best and good luck. I hope to sit for a while and see how the first round goes on. Otherwise, I'll be coming back and joining for the valedictory. Thank you, everyone, for this wonderful opportunity.
Thank you, sir, for your kind and inspiring words. It surely boosts us to strive hard and achieve more. Now, I would like to call upon our chief guest, Dr. Martin Ahmed Khan, to share a few words.
So, respected guests sitting on the dais and our dean sir, vice dean sirs, and Kavita ma'am, Sunita ma'am, and some of my friends who are in the audience. One only recently joined is one of my colleagues, Dr. Nitesh Kumar in microbiology, whom I find over here. And all dear students. Of course, one of my friends is now Binay also, of physiology, your head and vice dean. It's a great honor and privilege for me to have been invited as a chief guest. I'm really, really indebted to Mahe and then Manipal, Tata Manipal Medical College and the Department of Biochemistry. Actually, I'll make it very short and just I'll try to give a glimpse of biochemistry, how important. Of course, I am not a practicing biochemist because I practice clinical medicine. But still, I am a professor of biochemistry only because it helps me dealing with my patients much easier. I'm a radiologist as well, but I don't practice. The only thing is that biochemistry is important. That just you think that why we learn biochemistry? It's a study of life, basically. Just the cells, how they act, how they coordinate, how they talk, and then they just, assemble to make like multicellular organisms like us. So basic reactions are all the same in all cells. So what we study is the reactions, how they interact, how they get energy, how they are destroyed. So this all comes under the armory of biochemistry. And then the ecosystem, this just go back, cell, multicellular, and then ecosystem. Just think of some predator, in some, animal. Right? So rhodopsin photon acting upon photon, and then the reactions. Just think of how biochemistry is there. Even some predator is being alarmed that some enemy is there. So a lot of reactions occurring in your internal air. So just think of even the antibody antigen defense mechanism. And then once you know that, now we want to even manipulate it, and the drugs have arrived. these are all the mechanism of action. Even the mechanism of action which we teach in pharmacology is basically enzymes inhibitors. So all this, just I want to open up biochemistry, how this is interrelated to, and because nowadays I actually usually follow the examinations, PG examinations. And the PG examinations, biochemistry now find a place, maybe 15 to 16 questions in your PG examinations, even in INXit. So it has got an importance. I guess I have to say that all subjects are important and all subjects are interrelated. And now, of course, we have started even the integrated teaching. So now I guess you are becoming better doctors than us. In our time, it was not available, but now you are better placed to be a better doctor than us. And finally, this quiz and these things are co-curricular activities, which even NMC encourages to participate in, so that your minds open up. I tell everyone that doctors are probably the best person to have the best analytical skills, because you are given few minutes, maybe a minute to see a patient and then diagnose it and then treat it. That is the best thing. So if somebody asks you what are the best thing to be a doctor, then you say that yes, I'm going to have the best analytical skills in the society. Because doctors, you can't compare. Other sections may be lacking in doctors, but analytical skills are the best one. So there, and this quiz and these all things, your mind opens up. So consider your every quiz questions to be your patient, That's why you learn, that you consider everything, whatever comes in question, you consider it's my patient and I'm going to treat it, means I'm going to solve it. Probably that is going to be the main, advice to you all, students, dear students. I just cut it short over here and wish all the participants very best. May the best one, as well as may the best one win. And thank you very much again for giving me an opportunity.
Thank you, sir, for your precious words and in short detailing the essence of clinical and medical biochemistry. Now, I would request Professor Dr. Sunita Tripathi, Organizing Secretary of Biofest 2024, to introduce the organizing team and the department.
Good afternoon, everybody. I welcome you all to Biofest 2024, which is organized in the MTMC by the Department of Biochemistry. So before going to start our quiz, let me introduce all the members of organizing committee now. This year, I'm really delighted to see so many participants from different colleges. Last year, we didn't have so many. So we are really lucky and we are really privileged to have so many students from various colleges of Jharkhand. Yes, first, Dr. Kavita Rashalkar, she is the HOD Biochemistry, MTMC, and she is the head organizer of this function. This is myself. This is Dr. Shulekha Sinha. She is the professor of biochemistry in our department. This is Dr. Vikramaditya. He is the assistant professor. This is Dr. Nagamma. She is also assistant professor in our department. This is Dr. Elvis, another assistant professor of our department. This is Dr. Neelam. She is assistant professor of biochemistry in the MTMC, as well as she is in charge of PMH biochemistry lab or the central lab. He is Monit, the tutor of our department. This is Svetanka. another teacher of our department. This is the head technician of our department. This is another departmental technician. She is Kavita. She is Neelam. She is another technician of our department. And this is the most helpful person of our department. He is Anthony. And this is Mr. Krishna Mohan. He is the associate of Biochemistry department. And these are all demonstrator or junior doctors of our department who are working in the department of biochemistry. So I congratulate all the members of biochemistry department, the organizing committee, and I wish all the students a very good luck for their success in this quiz. Thank you.
Thank you, ma'am. Now the stage is ready for the students to exhibit their knowledge and talent in this academic extravaganza. So let us all sit back and have an enjoyable time seeing a bunch of brilliant minds fighting it out for the quizzing glory. We'll take some time to make the arrangements for the students. Please bear with us. I'll request one student from each medical college please come and do the lottery for the seating positions. One student from each college, each team.
Team 6, are you ready for the question? I am a competitive inhibitor of enzyme in plasma membrane. I am a hormone. I am used as an anti-inflammatory drug.
Vitamin D.
Wrong answer. Can I give you a clue? Phospholipase A2 I inhibit phospholipase A2 in plasma membrane and prevents release of arachidonic acid. Yes? Wrong answer. Team 1. Wrong answer. Wrong answer. Hormone. We are speaking about a hormone.
Glucocorticoid.
Very good. Cortisol is the correct answer. Team Rosalind gets 5 points. So coming to the last question of this round. I am an extract of willow bark used as a pain reliever from the times of Egyptians and Sumerians. Clue? Cyclooxygenase inhibitor used as an analgesic, antipyretic, anti-inflammatory and antiplatelet. Team 1?
Aspirin.
Correct answer. Hazaribagh gets plus 5. So by the end of the team round 1, we have first team, that is Hazaribagh, at 10 points, 5 points. The second one, that is LCMCH Palamo at 10 points. NGM Jamshedpur at 0 points. MTMC Jamshedpur 1 at 10 points. Jamshedpur 2, MTMC Jamshedpur 2 at 15 points. Dumka Medical College at 0 point and Dhanbad Medical College at 0 point. It's okay. There are lots of rounds to come and it's very exciting. We shall start with the next round now. I request Dr. Sulekha Sinha to take over for the next round. In between, we have a audience round.
Again, I will request one member from each team come and select your turn. Come on, baby.
So, very well done, guys.
We will have audience round.
Okay. So, again, rest for you all.
actress? Nobody will know her. You don't know, no? Oblivious to Bollywood. Which type of endocrine disorder is she suffering from? Katrina Kaif is suffering from hypothyroidism. So this is a fun round.
So, welcome to the second round. So this round basically is acting without speaking in medicine. So what kind of round this be? Damn sure, very good. Correct guess. So we'll tell rules of this round. Here, one of your team member will come. We will show any topic or something from the biochemistry. He or she will enact, and the other team members will identify. This we are very aware of dumb charade, right? Then each correct answer will be awarded with 10 points. There is no negative marking. There is no passover. Time duration will be 1 minute 30 seconds. Time duration 1 minute 30 seconds. Answer after that will not be considered. So do you want any demo? By which? Whom? The students, audience or faculty?
And the judge will
HOD?
sir. Okay.
Welcome. Who will guess? So ma'am is like enact. Who will guess? Again faculty? Audience, okay. Monit sir. Monit sir. मैम आप भी आ जाइए विक्रम सर is joining with Monit sir. Okay, so I am showing this topic to Kavita ma'am.
Enzyme, protein, metabolism, hemoglobin, disorder, sickle cell anemia.
Correct.
So you get 10 points ma'am. Congratulations. Okay, so now you have any queries regarding this round? Then tell me beforehand only. Do you have any queries? Correct answer 10 points. No negative marking, no passover. Time duration 1 minute 30 seconds. So we'll start with team 1. One of you member of come. Team 1. Ma'am, acha. This team 1. Okay. नहीं मैम सीक्वेंस में ही वो वाला ठीक है बड़े और रखते हैं ठीक है ओके सो यू इज टीम रेडी टर्न दैट साइड Is team ready? Your time starts now. Use the mic.
Whatever it's saying, say in the mic.
Correct answer.
Myocardial infarction.
So, thank you. Yes, team 1 get 10 points. So, this was acute myocardial infarction. So, we'll move to the next team, team 2. One of you, come forward. C and B. ठीक है? Wait. Ready? You can stand here. Time starts now.
Say in the mic.
Please use the mic.
Please use the mic.
मसल को हार्म करता है केराटिन तो फॉर्मेशन हार्म ग्रोथ को मसल्स को मारता है इनहिबिट एनीथिंग एल्स मसल से रिलेटेड क्या है कोई डिसीज है मस्कुलर डिस्ट्रॉफी
Yes, correct answer. Team 2 also get 10 points. So, Duchenne muscular dystrophy. So, anyone from team 3? So, are you team ready?
Yes, ma'am.
Your time starts now.
Use the mic and ask.
Disease. Dwarfism. Vitamin D.
विटामिन डी से डिजीज
Scurvy. Rickets.
Yes, correct answer. So, team 3 also get 10 points. So, one member from team 4. Is the team ready? Wait. Time starts now.
Metabolism. Disease. Tail. Hush brown. Albinism. Porphyria. Three words. One word. Disease. Back. Diarrhea. Pellagra.
Correct answer. Team 4 also get 10 points. Was funny, right? Enjoy? Wait. If they're ready? Are you ready? Okay. Your time starts now.
malnutrition, kwashiorkor marasmus.
So team 5 also get 10 points. Very well done by all the teams. Okay, so we'll move to the next team. One of team member, please come. Wait.
Scurvy.
Very fast. So again, 6 also get 10 points and very fast response. Wait.
Stone.
Oh, well done. So again, team 7 also get 10 points. So each team gets 10 points in this round. Very well done. And you all are very good in acting as well, I can say. Side business you can do. Okay, so we'll give the total at the end of this round. Team 1, 15 points. Team 2, 20 points. Team 3, 10 points. Team 4, 20 points. Team 5, 25 points. Team 6, 10 points. And Team 7, 10 points. Congratulations, everyone. So we'll move to the next round. Audience round, yes.
Is audience round fun? Which cancer? चार पांच दे दीजिए, सबने बोल दिया. Only those who will tell the marker. Advanced ovarian
I request audience, please don't shout. We are streaming live.
ovarian
Please.
cancer. But what
We are
is the tumor
streaming
marker?
live, so please I request you don't shout.
मार्कर ट्यूमर मार्कर गलत. बोलो आंसर बोलो. ओवेरियन कैंसर मार्कर. हाँ देख के बताओ. कौन फर्स्ट देख के बताएगा? CA 125. तुम सिर्फ ढूंढ रही थी, वहां पे उसने ढूंढ के बता दिया.
गुड जॉब ऑडियंस.
बताया तुम लोगों को ही पहले पूछा ना.
Okay, so I call for the next round Dr. Elvis Vishal. Dr. Elvis, please.
Hello everyone. So this round name is Visual Brain Twister. Okay. So madam, can I have the slide changer? So let me get you through the rules of this game. It's not working, sir.
I figured it out in there.
Okay. So these are the rules. Number 1. So in this challenge, you have to identify the correct answer based on the images provided within the 40-second time limit. Okay? And guessing and providing multiple answers are not allowed during the 40-second time limit. Okay? So every team, each team must come up with a single answer. It's not like that you are telling multiple answers, right? So you have to come up with a single answer. You will get 40 seconds to figure it out. So your aim is to solve the puzzle without any hint. However, if you ask for a hint from us, so a penalty will be imposed and 5 marks will be deducted from the total score. And for every correct answer, you will be awarded 10 points. No points for your incorrect response. So let me give you a demo first. Identify this metabolic disorder, right? So in this puzzle, we have 4 images to decipher. Okay? The first image shows a hand, money in a hand, symbolizing fees, right? Symbolizing fees. The next image shows a pharaoh, pyramids, and ancient Egyptians working beside a river, symbolizing what? The Nile River. Okay? Yes. The third image, features the representation of low carb diets, symbolizing the keto diet, and the final image displays the molecular structure of urea. So your aim is to combine all the clues to make or come up with a single answer. That makes sense. So this is phenyl ketonuria. Get the idea? So shall we start this time we are going to start from team Dhanbad. Okay? Are you ready?
Whatever you are speaking, please speak in the mic.
Identify this amino acid.
Please do not.
Leucine.
Okay, correct answer. So this is isoleucine. Team Dumka, are you ready? Team Dumka, are you ready? Identify this amino acid.
Tryptophan.
Correct answer. This is tryptophan, right? Team MTNC. Ready? Name the disease.
Heart knobs.
Correct answer. So this is heart nerve disease. Heart and up, right? Heart and up, right? Heart nerve disease. Okay, next question. Are you ready, MTMC? Again. Name the syndrome. Please don't prompt the answer. I request the audience don't prompt the answers.
Carcinoid syndrome.
Well done. This is carcinoid syndrome. So this one is carcinoid syndrome. Now team Palamu, are you ready? Oh, sorry, Jamshedpur. Name the disease. You have 40 seconds to answer.
Tyrosine.
It's a disease. You are partially correct. Time's up. It was partially correct. You want to answer the question? Tyrosinemia, right. So, Palamu, are you ready? Yeah. Identify this macroglobulinemia. नहीं. It's time up. Okay. The first picture depicts wall. You want to take? Okay. Time is up. Okay.
Walden syndrome.
It's close enough, but we call it
Waldenstrom.
Waldenstrom macroglobulinemia. Well done. Okay, Hazaribagh, are you ready for the next question? Identify this metabolic pathway. If you want hint, you ask within the 40-second time limit only. Which image you want? First one is election.
Electron transport chain.
Well done. So can we have the final score? Sorry? हाँ. Actually, we do not have the provision for the pass. It's just for an year. But you will get the marks for whatever you answer for your turn, right? No, we are not giving marks for past questions, ma'am. एक बार इस फाइनल स्कोर अनाउंस कर रहे हैं. एक मिनट, ये ऑडियंस सॉन्ग.
एडीए का नॉर्मल वैल्यू बोलो. एडीए का नॉर्मल वैल्यू
7200.
HbA1c का
5.6 to 6.5. Less than 5.6, pre-diabetic is 5.6 to 6.5, and greater than 6.5 is a diabetic.
We request Sunita Tripathi madam to take over for the next round.
Hello.
It has come to our notice that bad comments are being put below the video. Please do not do that. It's a state level quiz competition and poster competition in a medical college. Please do not do that. I request you.
Good afternoon, everybody. Again, we are going to have the next game. The name is Let's Play a Game, Guess My Name. Okay? So, before starting the game, actually, I would like to start. What is happening? नहीं दिखाया.
First from there.
No, that song is not coming now. कहीं से भी करेंगे, पहले स्टार्ट होने दो, गाना तो स्टार्ट होने दो. बैटरी नहीं है. Give me that again.
I'll do that. Next slide, next slide.
So before starting the game, I would like to play a Hindi old song which all of you must have heard and enjoyed. Of course, this is not of today's song, this is of my time, but everybody usually likes, so we want to play this. So, my dear students, we are going to use this concept for this biochemistry quiz now. Okay? Are you ready? All the students are ready? So, first let me tell you about the rules. Each team will be given a time of 30 seconds to answer. For a correct answer, 10 points credit will be given to that team. Incorrect answer will be leading to deduction of 5 points, so minus 5. Questions will be passed to the next team if answered incorrectly, so there is a pass. No time will be given for the pass question because you have already seen that. A bonus of 5 points to be given to the team answering it correctly, next team. An incorrect answer will lead to the deduction of minus 5 again. The next time if you are taking to answer, but if it becomes incorrect, then again there will be minus 5. Okay? Is it clear to everybody? So now I will give you a demo in which I will give you the hints about the question or the story given here. Here I will tell you the story in the form of my history, okay, in which I will say my home means it is the source of that nutrient. So this is a nutrient round, okay. So my home is this where I am available. My job, I have many functions, but one of them is this function, okay. And in my absence, the thief takes the upper hand, that is the disease which occurs in the deficiency of that nutrient, okay. Is it clear to everybody how to go about? Okay. Now, so let's play now. My home is this. I have many jobs, but one of my function is to metabolize tyrosine in the step for the conversion of homogenesic acid to mallyl acetoacetate. In the presence of homogenesic acid oxidase, I am a cofactor. In my absence, this manifestation occurs. So who am I? No, not to all. It will go to this team because we have finished there, no? The last team, you were the last team. Oh, from here. Yes, you have to answer. Dhanbad. Who am I? Time up. Time's up. Next team wants to join? Wants to answer? No. Anybody? Next three?
Vitamin C. Ascorbic acid.
नहीं, कोई बात नहीं. Yes. Very good. Very good. Correct answer. Next, this is my home. My job is maintenance of normal epithelium and skin, dark adaptation, antioxidant. In my absence, this thief comes. Who am I?
Vitamin A.
Very good. Correct answer. Third team. This is my home. My job is conversion of methyl malonyl CoA to succinyl CoA, and I am the cofactor in this presence, in this reaction, and in my absence, this disease occurs.
Vitamin B12.
Yes, very good. Correct answer. Next question is for you. This is my home. My function or my job is to do this, and in my absence, you can have this.
Calcium.
Who am I? Yes, very good. Next team. MGM. This is my home. This is my job. I work in many places, but in this reaction, I am the component of this enzyme. In my absence, this type of peripheral smear will be available. Who am I?
Iron.
Yes, very good. Very good. Correct answer. Next team. Palamu. I am a non-metal present in one of the amino acid. My function is intracellular antioxidant. In the deficiency, it develops a disease with cardiomyopathy and muscle atrophy. This disease was first observed in China. Who am I?
Selenium.
Yes. Correct answer. Very good. Next question. Hazaribagh Medical College. I am a ductile metal present in enzyme and non-enzyme protein, and my function is transport electrons in etc., tyrosine metabolism and melanin synthesis.
In my absence, this type of feature occurs. Who am I? No. Wrong answer. Anybody wants to try? Not all, not all.
Ma'am, until time is over, we will give that time.
No, change that. No. Change the answer. Oh, no. Achha, one more chance we can give because this was the last question.
Copper.
Yes. Yes, very good. This is the copper deficiency. Very good. So congratulations all teams, done very well. So total score, उसी को पढ़ देना बोलते हैं ना? कहाँ गया और माइक कहाँ गया? Finalized? Kavita? So team 1 total 25, team 2 30. Just wait.
वो बोल दिया है.
Cancel. इसको बंद करो ना, इसको बंद करो अभी तक. So team 1 25 score, 22 second team 30, third 20, fourth 40, fifth 50. So till now team 5th is the highest mark. Team 6 30 marks and team 7 20 marks. Congratulations. सब ऑडियंस को ज़्यादा ये है कब ऑडियंस क्वेश्चन आएगा. तो पानी बड़ा कुछ जब तो नहीं इसमें है नहीं, खाली है दूसरा, मैं ख़त्म कर चुकी हूँ. लास्ट का विक्रम का था ना. हाँ
I hope you all are enjoying the game. It's only 2 rounds left, so the scores are here. Don't be disappointed. 2 rounds are also there, so you can cope up in the next 2 rounds. Be enthusiastic and play well, okay? Keep up the good spirit.
बच्चे मांग रहे हैं ना, उन लोग को बोलो ना, उन लोग घुमा देगा. तो हमारे ये को बोल दो, उधर कौन ढूंढने में बैठा है उसका बोल दो. बच्चों का
So, the round is metabolic maze. So,
Please note this is a very important and toughest round. Good luck, Vikram. All the students as well.
things can change in this round. This is the penultimate round. Okay. So, this is all related to metabolism. Okay. We'll start from Team Hazaribagh and we'll go till Team Dhanbad. Right. So, I'll go to the rules. So, each team will get a clinical case scenario, right? The team with the direct question can either score 20 points maximum, 10 or 5, okay? So, if I am asking the question to Team Hazaribagh, they can score 20, 10 or 5, how I will tell you, okay? There is no passing. So, if they can't answer, the question doesn't go to you directly. So, what happens? Any team can challenge the answer. If they give an answer, if other teams think that their answer is wrong, you can challenge that answer, right? The team who challenges first gets the chance to answer. You can't give the same answer, it has to be a different answer, right? So it's not that they were correct and you also are correct, you can get the points. They have to be wrong, you have to be correct, the challenging team, then only you get the points. The direct team, if they give the wrong answer, there is no negative marking. But the team who challenges and gives the wrong answer, they'll get a negative mark. So, you can challenge and get extra points, you can lose points as well. Okay? So, you have to decide before challenging and be very particular why you are challenging and you need to give the correct answer. Right? Am I clear? Okay? Now, how can you score 20, 10 and 5 points? As soon as I end the question, you get 15 seconds time to answer without any options. If the team for whom the question is direct, so if I am asking you the question, as soon as I end the question, you get 15 seconds time to answer without any options. If you answer correctly, you get 20 points. Okay? If you answer incorrectly, other teams have an option of challenging. If the team who challenges and answers correctly, they also get 20 points. If you answer incorrectly after challenging, you get minus 10. Right? Okay? Next, after 15 seconds, the team doesn't answer. They want options. They will be given 4 options. And again, 15 seconds to answer. Right? In those 15 seconds, out of the 4 options, one will be correct. You give an answer. That team may be correct, may be incorrect. The other teams again have an option of challenging. This time, if the direct question with 4 options, they answer correctly, you get 10 points. Similarly, after challenging, you also get 10 points, but the negative mark remains minus 10. Because this time you are given 4 options. Right? Last, there is an option of 50-50. Ma'am, we can distribute 50-50 biscuits to all of them.
Thank you so much. Have it. Well, don't have it. If you have, you want that option, raise this. One to each team.
When you get 2 options, if you answer correctly, you get 5 marks. Okay? मैम मेरे लिए भी चाहिए ना.
Really?
So, direct, without any options, if you answer within 15 seconds, you get 20 points. With 4 options, you get 10 points. With 2 options, you get 5 points. Okay? Within 2 options also, I keep the challenge option open. Okay? Because I won't be telling whether that answer the team has given is correct or not. If you think it's incorrect, you can challenge. If you are wrong, minus 10. So the negative marks remains minus 10 for challenging and answering wrong in each of the steps. The direct team can score 20, 10 or 5 depending on whether they can answer directly with 4 options or with 2 options. Any queries? Clear? Shall we start? Okay. So the first question goes to team Hazaribagh. दूसरा नहीं है. Sorry for the glitch. Okay, so team Hazaribagh, your question. So, team 1, a 6-year-old girl was brought to the hospital with vision problems. She was found to have a downward dislocation of the left lens, had signs of osteoporosis. Biochemical investigations reveal high levels of homocysteine and methionine in plasma. The patient treated with a low methionine diet supplemented with B-complex vitamins. Identify the enzyme that is deficient in this patient. You get 15 seconds. Other teams also, be ready. Okay, you want 4 options. These are the options: cystathionine beta synthase, cystathioninase, homocysteine methyltransferase, phenylethylamine N methyltransferase. You want 50-50 option or you want to answer? You have to answer directly now. They said C.
Challenge. A. Cystathionine beta synthase.
Yes, correct. So, yes, Hazaribagh doesn't get any points. They get 10 points. So, team 2, Palamo, a 2-year-old boy was admitted for investigations for recurrent episodes of icteric sclera. The investigations show hemoglobin to be 8.4 gram %, total bilirubin to be 3.8 milligram %, indirect bilirubin 3 milligram %. There is reduced RBC lifespan and splenomegaly. Further investigations confirmed a defect in an enzyme of the energy yielding pathway in erythrocytes. 15 seconds. Options, okay. PFK1, glucose 6-phosphate dehydrogenase, glutathione peroxidase, pyruvate kinase.
Glucose 6-phosphate dehydrogenase.
Anyone wants to challenge? Wrong answer. You didn't challenge, so you don't get an answer. Audience? They said G6PD. एक एक करके बोलो, एक तो लग ही जाएगा. Yes, it's pyruvate kinase. Why? Question. पिछले वाला question दिखाओ. What is this? This is hemolytic anemia. What did I say? Energy yielding pathway. J6PD. How many ATPs are produced in HMP shunt pathway? Does it produce any ATPs? Then hemolytic anemia is caused by G6PD deficiency or pyruvate kinase deficiency. Energy yielding pathway, so it has to be of the RBC, of the glycolysis. So it's pyruvate kinase. Okay? Team 3. So, a native of West Africa came to the emergency with severe vomiting, epigastric discomfort and dehydration. He is a known diabetic and takes ackee fruit at his native place for treatment of his diabetes. Lately, he has consumed it in excess. The lab investigations reveal hypoglycemia and excessive excretion of dicarboxylic acids in urine. What is the most probable enzyme deficiency? 15 seconds. Options: carnitine palmitoyl transferase, medium chain fatty acyl CoA dehydrogenase, phytanic acid oxidase, hormone sensitive lipase. You want to answer?
The first one. Option A.
Carnitine palmitoyl transferase.
Medium
You want to
chain
challenge?
fatty acyl CoA dehydrogenase Jamaican vomiting.
Very
Option
good.
B.
Jamaican vomiting sickness, medium chain fatty acyl CoA dehydrogenase. MGN no marks, MTMC2 get 10 points. Are the questions very tough? Yes, yes and no, no. Are they interesting? Yes. Next, team 4. Team 4, a 2-year-old girl presented with recurrent abdominal pain and was admitted for follow-up. The serum separated was milky white. Yellowish papules are seen on the dorsum of the hand. The investigations show fasting TG to be more than 1000 mg per dl. Cholesterol levels are normal. What is the metabolic defect? 15 seconds. Options: LDL receptor defect, LCAT deficiency, lipoprotein lipase deficiency, ABC1 deficiency.
C. Lipoprotein lipase deficiency.
Correct. Lipoprotein lipase deficiency, 10 points. Next, team 5. Krishna. Team 5, 37-year-old male comes to the OPD
PLP.
with
PL.
probable nutrient deficiency.
Vitamin B6 PLP.
Anyone wants to challenge? Okay, 20 points, correct answer. Next, Krishna. Team 6, Dumka. A 2-year-old child was brought to the OPD with history of stunted growth, diarrhea, loss of taste, alopecia, and erythematous rashes over the face and perineum, which are typically symmetrical. What is the probable nutrient deficiency? 15 seconds. Options: niacin, zinc, iron, pyridoxine. Do you want to answer? You want 2 options. Niacin or zinc?
Niacin.
So challenge zinc. Challenge. So zinc. Zinc.
Which team?
Zinc. MGM बोल रहे हैं. So we said challenge zinc first.
I'm not in a position. They were back. MGM?
Zinc.
Okay, correct answer is zinc. So Dumka doesn't get any points. MGM gets 5 points. This is acrodermatitis enteropathica. Okay? Next. Okay, Dhanbad. A 6-month-old baby was brought to hospital with complaints of frequent vomiting, lethargy, refusal to feed, and irritability. Blood levels show high ammonia and urine shows the presence of orotic acid. A diagnosis of urea cycle disorder was done. What is the most probable enzyme deficiency? 15 seconds. Options: carbamyl phosphate synthase 1, N-acetyl glutamate synthase, ornithine transcarbamylase, argininosuccinate synthetase. You want to 50-50? Anyone wants to challenge? The correct answer is C, ornithine transcarbamylase. They get 5 points, they get -10. Okay, so the scores after this round. The audience wants to try one question? Okay. So while the points are being calculated, one question for the audience. Question दिखाऊं ना. A 12-year-old boy suffering from glycogen storage disease comes to OPD with decreased exercise tolerance. He has low lactate levels in the blood. Muscle biopsy shows high content of glycogen. Blood glucose level is normal. What is the most probable enzyme deficiency? Audience, बोलो. मसल हाफ चॉकलेट मिलेगा. हाँ तो एंजाइम क्या है? It's myocardial disease. Enzyme is? Yes. So it's muscle phosphorylase. Okay, scores ready. So at the end of this round, team 1 25 points, team 2 30 points, team 3 15 points, team 4 60 points, team 5 80 points, team 6 30, team 7 25. Okay, still one round to go. And that round is? Yes. And this round can cause fire in your scores. Over to you, ma'am.
There are chances scores might be drastically changed. That is how it happened last time. Those people who were in the last bottom, they won. So there is a lot of potential in this round.
वो बोलेगा आंसर तभी क्लिक करना है वो आंसर को, लेकिन दैट शुड बी क्विक सो दैट द नेक्स्ट क्वेश्चन कम्स इन. मैंने आंसर हो गई. नहीं एक पेपर रखो. ईच क्वेश्चन का 10 मार्क्स है. 1 10 करके 80 है टोटल 80 ना मार्क्स होगा ना 8 क्वेश्चन का. आपको पता है ना पीपीटी नो ना यू सी. Huh?
Once you share correct or incorrect,
You also be here listening to them, listening to the answer. You also be here.
Do you want us to start from here or there? कॉइन है? हाँ वही कॉइन है. हेड्स और टेल्स? First they told heads. No, नहीं सर, यहाँ पे सीक्वेंस बिगड़ जाएगा. Heads. Okay, if heads then Hazaribagh. If tails then Dhanbad. Okay. Both of you come. Heads.
So we begin with the round 6. This is the rapid fire round and the scores can go topsy-turvy. Okay, so be careful. There will be 8 questions. And there will be 8 questions in 1 minute time. 10 marks for each correct answer. No negative marking. Say pass if you want to skip the question. Questions left after time limit will not be asked and no questions will be passed to the next team. Right? So if you answer all the 8, 80 points, right? Monit, please see the time. Take 1 minute, I think. The questions will be there on the board. ठीक है? हाँ तो तुम लोग से start करो.
Oh, they say we have to start from here.
So you are the loser then. So the tough questions come at the last. Be careful. Now you cannot change your ये.
Once they answer or once they pass that question,
Then only the next question. Huh?
they cannot come back to that question.
You all cannot come back to that question, right? So if you say pass, the answer will be there on the board and then the next question will come up, right?
Is that clear? Rules clear to everybody?
Please answer on the phone, right? And like no two answers should be there, only one answer. If incorrect answer is given, pehle, then that will be considered. So be careful before answering, right? And be quick. They have a mic, sir. Come on. Team 1, ready? Come on, start. What is the normal value of serum calcium in an adult male? Quick, quick.
8.5 to 10.5 milligram
Correct.
per deciliter.
Vitamin deficiency, riboflavin. Deficiency manifestation. Quick, quick. You can skip also if you say. Energetics and anaerobic glycolysis.
You have to say number of ATPs.
2.
2, correct. Enzyme deficiency in galactosemia.
Galactose 1-phosphate dehydrogenase.
Wrong. Galactose 1-phosphate uridyl transferase. What is the rate limiting enzyme in cholesterol synthesis?
HMG co-reductase.
Correct. Intracellular site of the protein hemoglobin. What is the site of metabolism and gluconeogenesis?
Cytosol.
Liver. Anyway, so they had 7 questions only. And how many correct?
1, 2, 3 questions.
3 questions correct, so 30 marks. Team 2, are you all ready?
Mike.
Team 2, are you all ready? Come on, start. Normal value of urea in adult male?
0.7 to 1.4.
Correct. Oh no, urea, I said urea, not creatinine. Next, deficiency manifestation of thymine? Right. Anaerobic, urea cycle energetics?
Number of ATPs.
Enzyme deficiency of von Gog's disease? No, wrong. Glycogen breakdown enzyme? Rate limiting enzyme in glycogen breakdown?
Pass, ma'am.
Intracellular site of protein, catalase.
Mitochondrial matrix.
Wrong answer. And what is the site or organ of metabolism in bilirubin conjugation?
Liver.
Liver, correct. Last question was given.
What is the score, ma'am?
3. 3.
2.
Last question was pointed, last question was given.
With that.
Team 3, are you all ready? Normal value of creatinine in an adult male?
0.4 milligrams per deciliter.
Correct. Enzyme manifestation of pantothenic acid deficiency?
Barn food syndrome.
Yes, very good. Energetics of oxidation of palmitic acid?
106 ATP.
Very good. Enzyme deficiency of alkaptonuria? Good. Next. Rate limiting enzyme in heme synthesis? Very good, correct. Intracellular site of protein heme oxygenase system?
Pass.
Organ of metabolism, urea cycle or the site? Liver. Correct. Biomarker of pancreatitis?
Amylase and lipase.
Correct. How many correct?
7 correct and 1 pass. So 7 correct. Please maintain silence now. Team 4, are you all ready?
Please maintain silence. Do not frown.
Please do now. Start. Normal value of serum triglyceride.
More than 150 to 200 mg per dl.
Okay, correct. Deficiency manifestation of pyridoxine.
Pellagra.
Correct. Energetics of gluconeogenesis.
Pass.
Enzyme deficiency of homocystinuria.
Cystathionine beta synthase.
Yes, correct. Rate limiting enzyme in HMP shunt pathway.
G6PD.
Yes, correct. Intracellular site of the protein ATP synthase.
Mitochondrial membrane.
Yes, correct. The organ or site of metabolism of glycogenolysis. Liver, correct. Biomarker of acute intermittent porphyria.
ALA synthase.
देना है नहीं देना है आफ्टर द बेल मैम आफ्टर द बेल 6 करेक्ट
Triglyceride is wrong.
5 only then
5.
oh 150 to 200 they said This is team. This is take another mic. Team 5, are you all ready?
Yes, ma'am.
Start. Normal value of serum cholesterol in an adult male.
150 to 200 mg per
Correct. Deficiency manifestation of niacin. Very good. Energetics of TCA cycle. कितना ATP? Wrong. Hereditary fructose intolerance, enzyme deficiency.
Pass.
Rate limiting enzyme in glycolysis.
Phosphofructokinase.
Correct. Intracellular site of protein cathepsin.
Cytoplasm.
No, wrong. Organ of metabolism, a site of metabolism in melanin synthesis. Wrong. Biomarker of carcinoid syndrome. How many correct? Three correct, 30 marks. Team 6, are you all ready? What is the normal value of serum sodium in an adult male?
1
Serum sodium.
145 milligram in
136 to 145, you'll get marks. Deficiency manifestation of vitamin B12.
Pernicious anemia or megaloblastic anemia.
Yes, megaloblastic anemia. Energetics of HMP shunt pathway.
30 ATP. 36 ATP, I guess. Pass.
HMP shunt.
Pass.
Enzyme deficiency of albinism.
Albinism. अरे क्या था? I forgot. Shit. Pass.
Tyrosinase. Rate limiting enzyme in fatty acid synthesis.
Fatty acyl CoA synthase.
CPT1. Wrong. Alpha ketoglutarate dehydrogenase intracellular site.
Mitochondria.
Yes, correct. Chalo, I give marks. 3. Give marks for mitochondria.
Yes, ma'am.
The last team, team 7. Are you all ready? What is the normal value of serum phosphate in an adult male?
Wrong. Deficiency manifestation of vitamin D? Yes, correct. Rappaport liberating cycle, number of ATPs? Okay, next question. Enzyme deficiency of Niemann-Pick disease? Rate limiting enzyme in glycogen synthesis? Yes, correct. Intracellular site of the protein glycosidase? The site of metabolism, TCA cycle? The site of metabolism of? Let's complete it then. Biomarker of hepatocellular carcinoma? No, wrong. Alpha fetoprotein. And that was all nucleated cells. How many? How many? How many correct? 3 correct, plus 30. Till the scores are ready, let's have the audience round. Audience round. Audience round. Let's have the audience round. And now do as much Google you can do. Okay? Come on. Identify this logo. Identify this logo. Google, Google. Who can Google fast? Who can Google fast? Noto, so he did, his Googling was so fast, yes? What does Noto stand for? What does Noto stand for? What does Noto stand for? If you answer, then you get it. National Organ and Tissue Transplant Organization. So for Googling first, he gets 1. Next. So there are 4 questions, right? 4 questions for the audience. Now the next one, Dr. Vikram. Identify the mode of inheritance. How quickly you can capture this image and put it here. No, none get the answer. Okay, answer निकाल दे. Mitochondrial inheritance. Come on, let's try your luck with the third question. Third question. Kya? What is the answer? National health? किसको? नहीं, एक में सेल्स वाला ठीक बोली थी मैडम, बोली दे देने के लिए. National health? Yes, correct. So he gets it. And the last question. The one who answers will get 2 choices. No. Huh? No. This is orange. Orange in color. No. Huh? Even if you name all the organs, then also you will not get the answer right. It is It is leukemia. Who is? अच्छा. Come get it. दे दो. Come and take your chocolate. ठीक हो गया ना?
तो हम लोग से 5 नंबर आगे हैं, तो 30 सबको ऐड हुआ, फिर भी हम लोग 5 नंबर आगे हैं। हम लोग एक के साथ
टोटल हो गया?
क्यों? उन लोग के साथ थे। तो वही हम लोग
तो हाँ, टाइम है तो कोई बात नहीं, बोल लेते हैं कि वी वांट योर फीडबैक, वट एवर यू हैव लर्न, इफ एनीथिंग यू वांट टू टेल अबाउट दिस वीक, यू कम एंड टेल। एक एक को बुला के बोल देते हैं, तब तक उन लोग को खत्म कर देगा।
तो रिजल्ट उधर हो गया।
इन लोग अच्छा दिया, इन लोग के पास पेपर अच्छा आंसर, एक्टिंग अच्छा किया। यहाँ मैं एक्टिंग कर रहा था कि आपको पहले से आंसर पता है, बस आपको एक्ट करना है।
सबको लास्ट वाला अगर लास्ट बजर बजा तो
ऑलरेडी क्वेश्चन डिस्प्ले हो गया था ना, उनका ही दिया है। आप लोगों को भी दिया है।
हमारा तो क्वेश्चन आया ही नहीं. You were on the 7th question when the buzzer. They were on the 8th. They had already answered the 7th.
क्वेश्चन अगर डिस्प्ले हो गया था,
Question अगर display हो
क्वेश्चन ऑलरेडी पढ़ दिए थे, देन वी हैव
You didn't come to the 8th question.
उनका भी वैसे ही हुआ था, जिनका इनका ये कुछ था आंसर लास्ट।
We don't want to be biased. We want to be as transparent as possible.
आधा से आधा नंबर दीजिए. आधा अगर हुआ तो आधा रियलिटी में आंसर देने का टाइम होता है, तो उस हिसाब से तो हम लोगों को भी मौका मिलना चाहिए लास्ट क्वेश्चन। लास्ट क्वेश्चन
7 ही क्वेश्चंस हुआ था। हाँ, क्योंकि 1 मिनट हो गया था इसलिए।
They were answering the 7th. But their 8th question was already right.
आज तक एक एक आदमी आके बोलो, टिल दैट टाइम nobody will be.
Yeah, I would request Dhanbad students to give their experience.
After giving all the groups marks.
Marks is already there, ma'am. Ready.
Write down the marks and take the. Then they will give the. कविता, जल्दी से पोस्टर प्रेजेंटेशन करो।
Congratulations all the participants. Now I invite the poster presentation by the first winner. Whoever is the winner, first she should present her poster. Yes, come.
Do I bring my poster or? No, it will be displayed. They will display. You just have to tell. Okay. Go on explaining. कैलकुलेशन करो ना, हो गया ना? ओके, कहाँ भेजना है भेजो, इन लोग का उसका पोस्टर प्रेजेंटेशन करना है, इसके पास है। नाम किसके पास है?
दिखा रहे मैं कर दिया.
I request all the students to please occupy those places. We will start with the poster competition now.
मैम ये पोस्टर है, तो शी विल एक्सप्लेन लाइक
डिस्प्ले हम कर देंगे. You just stand here and or this side here. Okay? Otherwise नहीं ऊपर
कॉलर माइक और समथिंग कॉलर माइक
ठीक है. इसके साथ you will not be able to explain properly.
Hello. Hello.
Hello, check. Check. Hello. Hello, check. Problem. Hello. Hello, check.
ये ऑन कर दीजिए। आ जाओ।
No.
The first prize for the poster making competition goes to Alice Tata from RIMS, Ranchi. We would request her to give a short presentation of her poster.
Good afternoon, respected professors and my dear friends. I am Alice Topno, first year MBBS from RIMS, Ranchi. I have made this poster on vitamin A. I have written about its RDA, its sources. Its sources are from the animal and plant sources, and its actions. It is important for cancer treatment, like it is an antioxidant, and from the biochemical role, the rhodopsin is made up of 11 cis retinal and opsin, and when the light energy falls on it, it breaks into all trans retinal and opsin. The meta-rhodopsin 2 is important for the transducin effect. The transducin GDP turns into GTP, and then it activates phosphodiesterase, which helps to convert cyclic GMP to GMP, that helps in closure of the Na+ channel. And also I have included its causes and disorders and the assessment, how it is assessed from the dark adaptation test, from the RBP level in serum, from the spectrometry, from its normal blood level, and also its toxicity and also the deficiency. I have made this flip one. So the deficiencies are night blindness, bitoid spot, xerophthalmia, keratomalacia, and hyperkeratinosis and acne. Thank you.
We request our next winner, Ms. Tanishka Garg, to give her presentation.
A very good afternoon. I am Tanishka Garg, first year MBBS student from Manipal Tata Medical College, Jamshedpur. And today, I've got this wonderful opportunity to hold the dice and present my poster in front of you all. The topic for my poster is arterial blood gas analysis. Now, the first question is, why arterial blood gas analysis? Arterial blood gas analysis holds a very great clinical importance in biochemical investigations. Arterial blood gas analysis means using arterial blood to measure pH and partial pressure of oxygen and carbon dioxide in the blood. Understanding ABG analysis helps us to interpret a variety of disorders like respiratory, cardiac, or metabolic disorders. The parameters measured are pH, partial pressure of oxygen, carbon dioxide, concentration of bicarbonate, and the fraction of O2 saturated hemoglobin. All the normal values are listed here in my poster. In order to maintain a normal metabolism, body must maintain a normal pH. Sometimes there can be imbalances. Due to decrease in bicarbonate and carbonic acid ratio, pH decreases, leading to acidosis, while when bicarbonate and carbonic acid ratio increases, pH increases, leading to alkalosis. We can classify the disorders under 4 major categories: respiratory acidosis and alkalosis, and metabolic acidosis and alkalosis. When CO2 is increased in the blood, pH decreases, leading to respiratory acidosis, while when CO2 decreases, pH increases, leading to respiratory alkalosis. Both of these disorders are compensated by metabolic responses by kidneys. Next, we have metabolic acidosis. When bicarbonate levels in the blood fall, this leads to metabolic acidosis, while when bicarbonate levels increase, this leads to metabolic alkalosis. Both of these disorders are compensated by metabolic responses by respiratory system. Now, the major point of interest here is, due to metabolic disturbances, ionic balances also gets disturbed. This leads to hyperkalemia in metabolic acidosis and hypokalemia in metabolic alkalosis. This was all from my side about ABG analysis. Thank you for your attentive response.
Our next presenter is Mr. Ankit Mehti from Lakshmi Chandravamshi Medical College, Palamu.
Good afternoon, everyone. I am Ankit Mehti from Lakshmi Chandravamshi Medical College, Bisrampur, Jharkhand. I am presenting my e-poster. My topic of e-poster is copper metabolism important? Copper is an essential trace element which found in our body tissues. A small amount of copper for the body is to functioning, but we cannot make them, so we take as a from food. In multicellular organisms like us, copper metabolism involves in various steps like as uptake, distribution, absorption and excretion. The dietary sources of copper are meat, shellfish, leafy vegetables, etc. Absorption of dietary coppers are going through the partially absorbed in the stomach and through going to the intestine of the duodenum and ileum part, because of there is presence of zinc and the high content of phylates. Copper next transported to the liver and redistributed via the celluloplasmin, albumin and various amino acid. 50% of the copper is not excreted to the feces, and some amounts of are the via kidneys through the urine, and small amount are excreted out by sweat. So let's discuss about the functions of copper. There are the various roles of copper in copper metabolism, like as it helps in the melanin synthesis, heme synthesis and transportation of iron, etc. Let's discuss about the deficiency of the copper. Here we discussed about the two types of mainly disease. One is Wilson disease and another is Menkes disease. In Menkes disease generally occurs the deficiency of copper, and Wilson disease generally occurs the accumulation of copper in our body. In Menkes disease there are the one gene present is ATP7A gene, which is deficiency mutation occur and it's called the Menkes disease. And in Wilson disease there is the ATP7A gene mutation, it is called Wilson disease. And here in Wilson disease there are the many disease clinical manifestation like as hepatomegaly, jaundice, acute hepatitis, cirrhosis, etc., and also causes anemia, brain dysfunction. And also important disease related Wilson disease is Kaiser-Fleischer rings, which is a golden yellow color ring which is present in the golden deciment membrane of the cornea. And next coming to the Menkes disease. Menkes disease, it is the deficiency of the copper and it leads to the skin and hair, depigmented kinky hairs, low cupric ion and cerebroplasmic levels, and increased cupric ion and intestine and the kidney of copper ion. Thank you everyone for this my presentation, and I am grateful thank you to the Tata Manipal Medical College to give me this great opportunity, and the various faculty and team members of the Biofest 2024. And I also very thankful to our HOD sir, Dr. Matin Ahmed Khan sir, and Dr. Shravanti ma'am, and Dr. Manpreet Saini ma'am, Dr. Ruby ma'am, and Dr. Salman sir. Thank you very much.
Thank you very much, Ankit. It's time to announce the winners of the Biofest 2024 quiz competition. And any guesses? Yes, it's Team Rosalind with 150 marks. Sayat Patra, Aprajita Janna, Manavi Kabi, and Apratim Kundu. Any guesses for the second place? MTMC Team 1, Shreyashi Chaudhary, Tamanna Pandey, Shrija Kaul, and Ishani Mehti. I congratulate all the winners. The third place was taken by Pallamo Medical College, that is Lakshmi Chandravamshi Medical College and Hospital, Aman Raj, Angad Singh Gujral, Jastit Dev Purohit, and Suryaban Pratap Singh. The winner got 150 points. The second place was 110 points and third place was 60 points. I request Dean Sir and our associate deans to please give away the prizes. Team MTMC 2.
I think I would like to invite Venkathi from Manipal to join me.
Yes, sir.
I request Vijay to introduce
I also request Mateen Sir to join us.
I think check. Okay, let me take the privilege to introduce two colleagues from Manipal here today. We have Dr. Adarsh DK. He is Associate Professor in General Medicine. And we have Dr. Roshan, who is Assistant Professor in Surgery. I think they have been with us for 2 weeks and engaging classes for your final year students here. Thank you very much for your time, sir. Glad that you are here with us.
I request the winners, please come to take the prizes.
Usually each student is giving us.
Four things for one. Okay, then. Come. Things are ready.
अपराजिता जना, मानवी काबी, अप्रतिम कुंदो, congratulations to all the winners. I request the second prize winners to be here. श्रेयसी चौधरी, तमन्ना पांडे, श्रीजा पॉल, लता पॉल, and Ishani Mehti.
Three.
Please come for a group photograph. Third prize winners.
Take the certificate readout, Kavita. Take the certificate readout. It's easier for you to keep the certificate readout.
Angad Singh Gujral.
I'll be okay.
Jastidev Purohit. Suryaban Pratap Singh. Aman Raj. One group photograph, please. The winners of the poster competition, Alice Tapnor from RIMS Ranchi.
Hold this and some more to follow. It's all for you. Look at the camera for the photograph.
Tanishka Garg from MTNC Jamshedpur. I request the winners to please come for a group photograph.
All the winners. Posters. You get one or two. Those are come.
I request all the participants to please come for a group photograph. Followed by that, we will have a participant certificate.
बाहर आएंगे यहाँ नहीं होंगे.
Please wait. We will have a participant certificate first.
And then they would have group photograph for them to know we will do group photo in the area.
Followed by that, we will have a group photograph in front of the college entrance. Rashmi from Dumka. Rashmi from Dumka. No, sir. This is for quiz. Finalist of the quiz. All the students from Dumka, please come. Next, Samrat Kaushik from Dumka. Preeti Rani from Dumka.
साथ में देना था ना.
Please come for a group photograph.
ये भी दे दीजिए सर गिफ्ट.
उन्हीं को.
हाँ.
इधर all please.
Gift, sir.
Certificate जैसे कोड़ा माँ.
चलो इधर.
Thank you. All the students from Dhanbad, please come. Shubham Singh. Yes, sir. Shubham Singh. Navendu Shivam. Aryan Tijal. Apurva. Please come for a photograph, please. NJM Medical College, please come. I request Sunita Madam also to accompany us. Anupam Utsav. Shrikant Singh. Ashpreet Singh.
Congratulations.
Dharmesh. Please come for a group photograph. Hazaribagh Medical College, please come. Ayushi Anand. I request Shravanti madam to accompany us, ma'am. Sakshi Kumari. Jishna Kumari.
उधर देखो फोटो को
Diksha Bharti. Please come for a group photograph. Congratulations to all the winners. I request all the participants to assemble near the entrance of the college so that we can have a group photograph along with Department of Biochemistry and the organizing team.
चंद्रवंशी मेडिकल कॉलेज का स्टूडेंट्स के लिए हम
नहीं लेके आइए, एक ही दे देते हैं.
I request Dean sir to thank our chief guest and judge. Please be seated for 2 minutes. Sure, ma'am. I request Dean sir to thank our chief guest. Please assemble near the entrance. Arrange yourself so that the dean of the college as well as Department of Biochemistry and organizing team can come and join you. You can keep your things here only. After that, everybody